views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hey there, nice to see you. It's time for the Bronx Buzz. This is BronxNet's program where we talk to writers and editors and journalists and photographers and filmmakers, anybody who puts something out in the borough of the Bronx. And this evening, well, he's not really a journalist or a writer, but his colleague over there at BronxWorks, Eileen Torres, put out a very, very interesting op-ed piece, which we have talked about these concepts a lot, not only on this program, but on Bronx Talk as well. And that is the whole idea that if we have people who are mentally and socially stable, that's a very good foundation on which to build or rebuild our economy. And so my longtime friend, we were just discussing how long we've had our association. John Weed is the Assistant Executive Director at BronxWorks. So nice to see you again, John. How are you?
Thank you. Likewise. Very nice to see you.
I will fill the audience in on what you and I discussed very briefly before the show. When we debuted Bronx Talk, which is my other program, as many people know, let's see, it was October 1994. In February of 1995, John Weed at that time Citizens Advice Bureau was on our program talking about domestic violence at that time. And all these days I've been working on TV and John has been working, doing really important work in the Bronx. So that's my introduction. Nice to have you with us, John.
Thank you. Likewise.
So let's talk a little bit about this op-ed piece and the notion. The title of the op-ed piece was the importance of mental health in economic development. Addressing mental health needs will help more New Yorkers get back to work. Why do you and of course your colleague Eileen and people at BronxWorks think we've got to do that as the foundation to rebuild our economy of all things?
Well, we're seeing a lot, probably from the pandemic, an increased amount of mental health needs, which are really preventing people from going back to work in some cases. We know that there's a lot of jobs out there, but people aren't necessarily ready based on the fact that mental health is a real issue. So if we could, I think a lot of what Eileen was trying to say there is that programs really need to have a mental health component in order to help people along and, work side by side with the job training and job preparation component of a workforce program.
Mm-hmm. So let me ask you this. We've done a number of shows through the pandemic about mental health separately. Where do you see, and I'll assume you're speaking for Eileen as well, where do you see having those services available? There is mental health service available. Right now, the city is wrestling how to apportion it in the schools. We get that, but to tie it to economic development, where do workers get it, or prospective workers can they get that kind of service?
I think right now it's very individualized, so that the mental health service are in a clinic or some location that's in a separate entity. But if we could embed mental health workers within workforce development programs, it would marry the two programs together and would really be a good effort in terms of getting people the mental health needs that they need on site at a location where they're also getting the workforce skill training.
So let's just be real specific about it. The city has, Workforce One and has all that workforce development that's out there. Organizations like yourself and other settlement houses that are part of UNH also provide these things. You're saying that if you do a workforce development program, this should be a component as part of that program, because you're not going to get somebody to get to step 2 before they get to that step 1 to be mentally ready to work.
That's right. and if there could be funding within
Ah,
programs like ours to hire mental health clinicians, whether they're licensed social workers or psychologists, they could be within these programs, and it could be one more step on the way for persons to get gainfully employed. I think
mhm.
it's a very important thing that we're seeing now that the pandemic is somewhat easing up, that people are still afraid to go back into the workforce setting because of this issue.
Mhm. How related to the pandemic is, and I'm going to use a bad word, some of the dysfunction that you see, or some of the issues that people have that prevents them from working? Is it something related to the pandemic, or did the pandemic really exacerbate some other issues that are out there anyway? I'm fully in support of getting mental health support regardless of what
Right.
the issue is. But I'm curious if this particular time has kind of made it worse.
I think it's made it worse. I think it's always been there, but with the isolation and the loss that people have experienced here in the Bronx with people dying in families and people having COVID. And the unemployment rate was skyrocketing. It was up to about 25%.
That's right.
So people have been really saddled with a lot of loss and mental health is a result of that. Um, so we're seeing a lot of that in a lot of our programs. It's not just the workforce; it's youth programs, it's other programs. But we're speaking specifically about economic development, and that's workforce. So in order for people to go back to work and to be gainfully employed, and for the retention to be there, right? For people to not only get a job but hold on to the job, they need to have their mental health attended to.
I'm just thinking out loud. So here's somebody who maybe lost somebody in the family. I mean, we know how badly the Bronx was hit for any number of reasons. They lost a family member. They've had to be cooped up. They're not in the position to get up every morning and get on the train and go to work. And so it's kind of disrupted that rhythm. Now to get somebody at a point where their lives are stable, their families are stable, their homes are stable. They feel safe just getting on the subway, and
Right.
hopefully, of course, wearing a mask and doing the right thing in that way, maybe getting vaccinated as well. Um, it takes a lot. And what you said about retention is a big thing. You can get the job, then they can't show up every day, or they come late every day, or mentally they can't sit there from 9 to 5 or whatever the job is. That becomes a really big problem.
That's right. And retention is a big part of our workforce development. So we offer, as you know, with BronxWorks, we offer wraparound services. We have programs that are for the entire family. And so we try to help people in some of these, whether they have housing needs, whether they have income needs, whether they have childcare needs. And childcare has been a huge issue for people going back to work.
That's right.
But so there's the loss, there's the job, the income loss, there's the emotional toll of having family members die from COVID. All of those are factors. So mental health is really something that we really need to beef up. I think the city should think about that. And in addition to the funding that we receive for the workforce training and the skill development of people to go into certain sectors of employment, I think, the mental health should be side by side with that.
Do you see that as like an overall funding? Like, we'll give. I don't even want to guess at a number. It's never large enough. That they give you like a grant for mental health, or say per training. We will provide X number of dollars to make sure that person gets a chance to at least speak with a therapist of some sort.
Yeah, I mean, it could be done either way. I mean,
Hmm.
it could be part of the grants that we already have to proportion a certain amount for a counselor, so for a mental health counselor, and that person could be embedded in the agency and be able to be there upon intake, right?
Hmm.
So there's not only the assessment of the employment needs, but there's also an assessment of the social emotional needs of the person
Hmm.
coming into our program.
That really summarized it now. So this is a matter of awareness, and why she put out the op-ed piece was awareness, making elected officials and other people aware that we've got to, take a look at this. In the last couple of minutes, I just want to give you a chance to boast a little bit about the effect that BronxWorks and all the great work you, Eileen, and all my friends over there do. Um, this has been a challenging time for you. Do you feel like you're catching up, or is it just always more people to serve than you could even imagine resources
Right.
as for?
Well,
I'm just curious. Go ahead.
BronxWorks never really shut down. We were here. We took on new programs. We took on programs where kids couldn't go into the schools, so they came into our facilities. We ran 9 food pantries. There was a huge need for food throughout the Bronx, and then now we're coming back with jobs, trying to get people employed. So there were really a number of new initiatives that came about because of the pandemic, and some of the needs that have always been in the Bronx only became greater because of the pandemic, and we've been trying to address those needs as they come up.
Was there funding that dried up because those wherever it sourced from was not available, whether it was private funding from foundations or funding from individual grants, because now the government had to cut back on certain things? Did that become a problem along the way?
Well, I mean, in the beginning of the pandemic, there was a lot of goodwill out there. We were receiving a lot of emergency grants from foundations and private donors, and that was great. And that continued for a while. That somewhat dried up. I wouldn't say dried up, but it somewhat decreased. But we've maintained a good source of income to keep our programs afloat. Just I mentioned food pantries. I mean, that was a big part of what we did for a year and a half, and we still. And I don't think that's going to end, because I think the food insecurity issues in the Bronx remain high. Unemployment was very high. It was about 25%. Not sure exactly where it is now, but it's dropped down some, but it's still up there. So through and through, there are lots of needs here in the Bronx, and we've tried to address those through all of our programs.
Well, I was just going to say we're just about out of time. Being versatile enough to move with the changes, and I was going to bring up food insecurity, which was almost not that it didn't exist, but was a new revelation through the pandemic. So I just want to thank you, John Weed, and of course Eileen Torres, and all my friends at BronxWorks. People list the problems that you see in the Bronx, whether it be housing or domestic violence or other issues or job development. BronxWorks never stops. They keep going, and they're completely committed to solving all of these issues that really rage in our borough, unfortunately. So that's the way I want to conclude. Any last words? You want to just say people check out BronxWorks.org? Is that what we're doing?
Yeah, you can check it out, BronxWorks.org. We have all of our programs listed on the website. We've revamped the website, so it's new and exciting, and hope that folks will take advantage of that.
Yes,
it's always a pleasure to be on your show,
John. It's great, and I thank you for the years of dedication to our borough of the Bronx, making things better for people, and of course our association all these years. So what we'll do is we'll take a short break. When we come back, talk about motivating people. We have a guy who owns a business in the Bronx, but in his inside, he's about motivating people, and he wrote a great book about learning how to do better for yourself. And we're going to talk about that in just a moment, so don't go away.